For our project, we focus on addressing maternal mortality rates among African American women in Louisiana. Maternal mortality rate is defined by the Center for Disease Control and Prevention as the death of a woman during pregnancy or within 1 year of the end of pregnancy. Black women are 2 to 3 times more likely to die from pregnancy related deaths than white women. The maternal mortality rate reported by the CDC for Black women in the US was 40.8 per 100,000 births. For deeper research, we decided to focus on the state of Louisiana. Louisiana has the highest rate of maternal mortality for Black women with 77.6 deaths per 100,000 live births in 2016, which increased from 9.7 per 100,000 live births in 2011. This graph is showing the pregnancy-related mortality ratio by race and ethnicity. Non-Hispanic Black women have the highest mortality rate compared to other races and ethnicities shown.
This graphic shows how likely Black women in Louisiana are to die from pregnancy-related deaths compared to those who are not Black. The maternal mortality rate is nearly 23% compared to under 6% for white women. Black women are 4 times more likely to die compared to white women. There are several risk and protective factors that contribute to high maternal mortality rates among Black women in Louisiana. The risk factors include lack of access to healthcare, having pre-existing conditions, and being subject to medical racism. These factors all increase the risk of maternal mortality because Black women are not being offered the necessary healthcare services they need, especially if pre-existing conditions are also involved. Black women are also discriminated against because of their race, so women are less likely to seek medical attention, feel as though they are being heard, or do not receive proper treatment. Protective factors include the development of standardized policies, doula programs, and ensuring continuity of care. All three of these make sure the pregnant woman has access to the necessary information and resources, along with receiving the proper medical care during pregnancy and postpartum. The purpose of the study is to evaluate previous interventions and come up with new recommendations that focus on reducing maternal mortality for Black women in Louisiana. To research this topic, we used a few different databases, including PubMed, UMass Libraries databases, and the CDC. We used several keywords that relate to our research topic in order to find studies that focus on maternal mortality for Black women and previous interventions that have been used.
7 intervention studies were examined to assess various interventions to help reduce maternal mortality rates in Black women, where most of the experiments were randomized control trials. After analyzing this data, we divided our interventions into educational intervention and behavioral intervention. The goal of the educational intervention was to improve the knowledge of both patients and medical staff services available, preventing avoidable inequities, and appraising the process of care transitions to ensure coordinated and continuous care of the patient. So in our educational intervention, we have the education of patients and training of staff. The intervention utilized to educate patients and staff included the distribution of patient information material, staff training curriculum, and schedule, an intervention checklist, as well as a process for patients to establish care with the primary care provider. The combination of patient education materials and services, instructions regarding the need for PCP follow-up, and the telephone call after discharge resulted in a 39% in PCP use. Our second intervention in educational intervention is family support workers and community of care. Family support workers, also referred to as parent educators, work to improve mother-infant relationship, child development, child safety, and educational work planning, as well as screening to ensure that families' basic needs are being met. Allocating a knowledgeable health care worker to educate and advocate for patients throughout their pregnancy, as well as during and after birth of their child, would drastically improve care transition in Louisiana. Study findings regarding continuity of care indicate that preparing for care transitions improve the knowledge of both patients, staff of the process, which subsequently prevents the occurrence of avoidable pregnancy-related deaths. Our second intervention is behavioral intervention. These experiments were randomized control trials and observed the changes in how these experiments improve maternal mortality in African American women. First, we have reduction of tobacco smoke exposure. In this randomized control trial, we observed that the intervention rates of very low birth and preterm birth were significantly improved when tobacco smoke exposure was reduced. Our second intervention in behavioral intervention is home visits by nurses. The results showed that fewer women who were visited by nurses showed pregnancy-induced hypertension, reduced childhood injuries, and subsequent pregnancy among low-income women with no previous live births. Our third intervention in behavioral intervention is doula home visits. A randomized controlled trial conducted showed that doula home visits had a positive impact on infant behavior care and positive impacts during postpartum and months after birth for both mother and infant.
Some of the educational and behavioral interventions in the studies analyzed for this presentation were found to be successful, while others required further research to determine their feasibility. We conclude that there is a need for a combination of evidence-based individualized strategies, behavioral adjustments, and organizational level quality and training interventions to help improve the pregnancy outcomes among African American women in Louisiana. The recommendations we have developed for reducing maternal mortality include reducing tobacco smoke exposure, implementing doula home visiting programs, ensuring continuity of care, and mandating staff education and implicit bias training within healthcare facilities. Reducing smoke exposure while pregnant is a recommendation that is essential for our community because exposure to tobacco smoke has been shown to have negative implications in maternal and infant mortality. Policymakers should work to enforce rules and regulations, for example, creating designated smoke-free areas outside, which are safe for pregnant women, and this should be enforced and regulated by the government. Studies observing doula and nurse home visiting programs have shown that having a trained healthcare professional advocate for the patient throughout the pregnancy is effective in reducing maternal mortality rates and improving the quality of prenatal care and pregnancy outcomes. Healthcare facilities ensuring continuity of care, along with smooth and comprehensive care transitions throughout the pregnancy, delivery, and postpartum period would drastically improve the health outcomes of Black mothers in Louisiana. Patients who receive continuity have been proven to have better health outcomes, more overall satisfaction, and the healthcare they receive is more cost-effective. And finally, mandating staff education and implicit bias training can help reduce maternal mortality, specifically among African American women. This recommendation makes sense for our community because Louisiana suffers higher maternal mortality rates for the study population. Educating the healthcare providers, doctors, and nurses would create more comfort and reassurance for Black women who decide to have children.